Could artificial intelligence enhance the accuracy of chest radiographs interpretation in real-world clinical practice? This question sparks our exploration into a new frontier of medical technology. Today, we delve into a study that seeks to compare the accuracy of chest radiograph interpretation, assisted by AI-based computer-aided detection, or AI-CAD, with conventional interpretation. The study focuses on patients who presented to the emergency department with acute respiratory symptoms. The aim is to evaluate if AI can improve the diagnostic process in a real-world clinical setting. Patients with acute respiratory symptoms who underwent chest radiographs at the emergency department of a tertiary referral institution were the subjects of this study. They were randomly assigned to one of two groups. In the intervention group, radiograph interpretation was assisted by an artificial intelligence-based computer-aided detection system, or AI-CAD. This group utilized the Lunit Insight CXR to help in the interpretation of the chest radiographs. The control group, on the other hand, performed their radiograph interpretation without any AI assistance. The main outcomes they focused on were the sensitivity and false positive rates of interpretation by duty trainee radiologists when identifying acute thoracic diseases. Their reference standards for acute thoracic disease were established based on a review of the patient's medical records at least 30 days after the emergency department visit. A total of 3,576 participants were randomly assigned to either the intervention group or the control group. The sensitivity, which is the ability of the test to correctly identify those with the disease, was 67.2% in the intervention group and 66.0% in the control group. The false positive rate, which is the percentage of healthy people who incorrectly receive a positive test result, was 19.3% in the intervention group and 18.5% in the control group. Interestingly, these rates of chest radiograph interpretation by duty radiologists were not associated with the use of artificial intelligence-based computer-aided detection. So what does this mean? Simply put, AI-CAD did not improve the sensitivity and false positive rate of chest radiograph interpretation. So, what does this mean for the future of medical diagnosis? The study concludes that artificial intelligence-based computer-aided detection, or AI-CAD, did not enhance the accuracy of chest radiograph interpretation in diagnosing acute thoracic disease. This was observed in patients who presented with acute respiratory symptoms in the emergency department. It's important to note that this study was conducted in a real-world clinical setting, where the pace is fast and the stakes are high. The sensitivity and false positive rate of chest radiograph interpretation held steady, regardless of whether AI-CAD was used. This suggests that while AI has potential in healthcare, further research is needed to refine its application in real-world clinical settings.